Hey everyone, Dr. Ryan Westbrook here. Today, I want to talk about something that affects millions of people worldwide, and something that frankly scares a lot of folks. We're talking about Alzheimer's disease, and more importantly, the early warning signs that doctors are trained to spot before they become obvious. Now, I know Alzheimer's can feel like a scary topic, but here's what I've learned after years in practice. The earlier we catch the signs, the better we can prepare, adapt, and take action. And that's what today is really about. Helping you recognize what matters so you can talk to your doctor if something doesn't feel right. Let me be clear from the start. I'm not here to diagnose anyone. I'm a physician, and nothing I say replaces a proper medical evaluation from your own healthcare provider. If you notice any of the signs we discussed today in yourself or someone you care about, please reach out to your doctor, okay? Let's dive in.
Most people think of Alzheimer's as just memory loss. Someone forgets where they put their keys, or they forget what someone told them yesterday, and suddenly everyone's worried. But here's what doctors actually know. There's normal forgetting, and then there's something that warrants attention. The difference is actually pretty important to understand. You know, we all forget things. I forget where I parked at the grocery store. Last week I walked into the kitchen to get something and completely blanked on what I came for. That's just life. We're busy, we're distracted, we're managing a million things. That's normal memory variance, and that's not Alzheimer's. But with Alzheimer's, the memory loss is different.
It's more persistent, it's more disruptive to daily functioning. And here's the kicker. People with early Alzheimer's often don't remember that they don't remember. They'll tell the same story 3 times in one day, forgetting they already told it. They'll ask the same question repeatedly. This isn't just forgetfulness. This is their brain changing in ways that affect how they retain new information. And get this. This is something a lot of people don't realize. Alzheimer's disease is actually the most common form of dementia. It accounts for about 60 to 80% of all dementia cases. We're talking about a condition that's incredibly prevalent. So understanding what to look for matters. It matters for you, and it matters for the people you love.
Let's talk about what's actually happening in the brain when someone develops Alzheimer's.
Now, I'm going to keep this straightforward. Alzheimer's is a neurodegenerative condition. That means the brain cells are literally dying. This doesn't happen overnight. It happens gradually over years, sometimes many years. In Alzheimer's disease, 2 specific things are happening at the cellular level. First, plaques are building up between nerve cells. These plaques are made of a protein called beta amyloid. Second, tangles are forming inside the nerve cells. These tangles are made of another protein called tau. These proteins, the amyloid and the tau, they're damaging the connections between brain cells. They're causing brain cells to die. And as more and more brain cells die, the brain actually shrinks. Brain regions that are important for memory and thinking stop working the way they should. The prefrontal cortex, the temporal lobe, the hippocampus, these are the areas often affected early on. And that's why memory is often one of the first things we notice changing. Now here's what I want you to really understand. The disease process starts years, sometimes decades before anyone notices obvious symptoms. That's called the preclinical stage. During this time, plaques and tangles are building up in the brain, but the person feels and acts completely normal. They're functioning fine. No one, including them, realizes anything is changing. This stage can last a very long time. Then we get to what doctors call mild cognitive impairment, or MCI. This is where we start seeing subtle changes. These are changes that loved ones might notice, or that the person themselves might notice. But the changes aren't yet severe enough to significantly interfere with daily activities. This stage is really important because it's when early intervention can potentially help the most.
And then there's dementia due to Alzheimer's disease.
This is where the cognitive changes become significant enough to interfere with daily functioning. This is what most people think of as having Alzheimer's. So let me walk you through the specific early signs that doctors watch for. These are the things that, when we see them, make us think we need to investigate further. First up, memory loss that affects daily functioning. Like I mentioned, normal forgetting is different from Alzheimer's memory loss. But what we're looking for is a pattern. Someone repeatedly asks the same question. They forget important appointments or events. They lose track of dates and times. They get lost in familiar places. They might put things in unusual places and then can't remember where they put them or why they put them there. This isn't once in a while. This is recurring. This is noticeably different from how that person used to be.
Second sign, difficulty with familiar tasks.
And this is interesting because people often don't bring this up in conversation, but we ask about it specifically. Can you still cook your favorite recipe? Can you still pay your bills? Can you still manage personal hygiene without help? Can you still drive safely? Someone with early Alzheimer's might start to struggle with these routine tasks. They might get confused by steps they used to do without thinking. A recipe they've made 100 times suddenly seems complicated. They might forget to finish things they start.
Third sign, and this one really matters, difficulty finding the right words.
We all occasionally struggle for a word, right? You know what I'm talking about, but the word just isn't coming to you. That's normal. But someone with early Alzheimer's might struggle more frequently. They might lose track of what they were talking about mid-conversation. They might use the wrong word. They might call things by incorrect names. Hand me that flat silver thing instead of fork. And it's not that they're tired or distracted, it's a pattern. Fourth sign, problems with abstract thinking. Paying bills, managing finances, understanding new technology, these require abstract thinking. Someone with early Alzheimer's might start to struggle here. They might have trouble balancing a checkbook. Numbers might not make sense anymore. They might struggle with concepts they used to understand easily.
Fifth sign, poor judgment. And this is one that loved ones often notice first.
Someone might start to neglect personal hygiene or housekeeping in ways that are unlike them. They might forget to eat. They might leave the stove on. They might start making questionable financial decisions. They might inappropriately share personal information. Their judgment in social situations might change. Sixth sign, mood and behavior changes. Depression is very common in early Alzheimer's, but we also see anxiety, agitation, irritability, mood swings. Someone might become withdrawn. They might lose interest in activities they used to enjoy. Hobbies they loved suddenly don't appeal to them. They might become suspicious or accusatory without reason.
Seventh sign, changes in personality.
This is something loved ones often find most difficult. Someone might become more passive than they used to be, or more aggressive. They might become more emotional than usual. They might struggle with social situations in new ways. These personality changes can be subtle at first, but over time they become more noticeable. Eighth sign, disorientation to time or place. Someone might get confused about what day it is. They might lose track of seasons. They might not remember where they are. They might not understand the time of day. Again, this isn't a one-time thing. This is something that happens repeatedly. Ninth sign, misplacing things. Most of us misplace things occasionally, but someone with early Alzheimer's might lose things frequently. And here's the tricky part. They might accuse others of taking or stealing their belongings. This isn't intentional accusation. It's their brain trying to make sense of something they can't remember.
10th sign, withdrawal from activities or social situations.
Cognitive changes can make activities like hobbies, work, or social events feel stressful or confusing. So someone might start avoiding these things. They might stop attending clubs or gatherings. They might become more isolated. They might stop doing activities they used to love. Now, I want to talk about something really important. There's something called the MMSE, the mini-cog test. This is a simple cognitive screening tool that we doctors use. If you're concerned about yourself or someone you care about, your primary care doctor can administer this. It takes about 3 minutes. It involves some memory questions, some attention questions, and a simple visual test. It's not a diagnosis, but it's a good screening tool to help us identify if further testing is needed. There's also the Montreal Cognitive Assessment, the MoCA, which is another tool we use. It's a bit more detailed.
Here's what I tell my patients. If you're noticing changes in yourself or someone you care about, real, meaningful changes that are different from that person's baseline, it's worth getting checked out. Early detection matters. It matters because early intervention can help. It matters because preparation matters. It matters because knowing what you're dealing with is better than wondering. Let's talk about what happens after someone shows these signs. If someone comes to my clinic with concerns about cognitive changes, here's what we do. First, we take a detailed history. I want to know about the person's family history because Alzheimer's has a genetic component. I want to know about their medical history. I want to know about any previous injuries or conditions. I want to know about medications because sometimes medication side effects can mimic cognitive decline. We do a physical exam. We check blood pressure, heart rate, general neurological function. Then we might recommend blood tests. Recent research has given us new blood biomarkers for Alzheimer's.
We can now do a simple blood test that looks for those amyloid and tau proteins I mentioned earlier. This is revolutionary. Even 10 years ago, we couldn't do this. Now we can get objective biological information about whether Alzheimer's changes are happening in the brain. This can help us make diagnoses earlier. We might recommend cognitive testing. Neuropsychological testing is more detailed than the quick screening tools. It takes longer, but it gives us a really clear picture of what's happening with memory, attention, language, visual spatial skills, and executive function.
We might recommend brain imaging.
A structural MRI can show us the size and shape of different brain regions. Some areas shrink with Alzheimer's. An MRI can also rule out other things that might be causing cognitive changes, like a brain tumor or stroke or normal pressure hydrocephalus. These are conditions that can mimic Alzheimer's but have different treatments. PET scans are another tool. Amyloid PET and tau PET can actually show us those proteins we've been talking about. They can show us where in the brain these changes are happening. The point is, we have tools now. Diagnosis isn't what it used to be. We can actually be pretty confident about identifying Alzheimer's disease in the early stages, and that's important. Let's talk about risk factors. I think understanding what increases your risk for Alzheimer's is important because some of these things are modifiable. You can do something about them.
Age is a risk factor.
The older you are, the higher your risk. Most people diagnosed with Alzheimer's are 65 and older, though early onset Alzheimer's in people under 60 does happen. Family history matters. If you have a parent or sibling with Alzheimer's, your risk is higher. And there's a specific gene, the APOE4 gene, that increases risk. But having this gene doesn't mean you'll definitely get Alzheimer's. Genetics isn't destiny. Cardiovascular health is really important. High blood pressure, high cholesterol, diabetes, these increase your risk. Why? Because the brain needs a lot of oxygen and nutrients. If your cardiovascular system isn't working well, your brain suffers. Head injuries matter. Traumatic brain injury increases risk of cognitive problems later in life. Cognitive inactivity. If you're not challenging your brain, you're potentially increasing your risk. Social isolation increases risk. Staying engaged socially is protective.
Sleep problems increase risk.
When you sleep, your brain clears out metabolic waste, including those amyloid proteins. Poor sleep is problematic. Depression increases risk. And here's something people sometimes don't realize. Hearing loss increases risk. If you're not hearing well, you're not getting the same sensory input. Your brain gets less stimulation. That's an important modifiable risk factor. So what can you do? How can you reduce your risk? Let me share what the research actually shows is protective. Regular physical activity. This is huge. Moving your body, getting cardiovascular exercise, strengthens your heart and brain. Aim for 150 minutes of moderate intensity exercise per week. That's just 30 minutes 5 days a week. It doesn't have to be complicated. Walking counts. Healthy diet. Mediterranean-style eating is supported by research. Lots of vegetables, some fish, healthy fats, whole grains. A diet rich in antioxidants and anti-inflammatory foods protects your brain. Cognitive stimulation. Learn something new, solve puzzles, read challenging books, play strategy games. Keep your brain engaged. Social engagement. Spend time with people. Have meaningful conversations. Join groups or clubs. Volunteer. Loneliness is terrible for your brain. Quality sleep. Aim for 7 to 9 hours nightly. Good sleep hygiene matters. That means a dark room, cool temperature, no screens before bed, consistent sleep schedule. Hearing care. If you have hearing loss, get it addressed. Hearing aids aren't just about hearing better, they're about protecting your brain. Blood pressure control. Keep your blood pressure in a healthy range. If you have high blood pressure, work with your doctor to manage it.
Diabetes management.
If you have diabetes, keeping it well controlled protects your brain. Stress management. Chronic stress damages the brain. Meditation, yoga, breathing exercises, time in nature, these all help. Purpose and meaning. People with a sense of purpose have better cognitive outcomes. Find something that matters to you. Now, I want to be real with you about something. If someone does develop Alzheimer's disease, we don't currently have a cure. I wish I could tell you otherwise. We have some medications that can slow down cognitive decline in early stages. Medications like aducanumab and donanemab have shown promise in clinical trials. These are monoclonal antibodies that target those amyloid plaques. They're not perfect, they have risks, but they do offer some benefit for people in early stages.
We also have medications that provide symptomatic relief. Donepezil, rivastigmine, and galantamine can help with symptoms by preserving acetylcholine in the brain. They don't stop the disease, but they can help people think more clearly and function better. And we have non-drug interventions: cognitive training, physical activity, social engagement, a healthy diet. These all help. They help with symptoms. They may help with progression. But here's what I really want to emphasize. Early detection and early intervention lead to better outcomes. If someone is diagnosed early, before there's significant cognitive decline, we can put interventions in place. We can help people plan for the future. We can help families understand what's happening and prepare. We can potentially slow decline. That matters. That really matters. I also want to talk about something called cognitive reserve. This is a fascinating concept. It's the idea that your brain builds up reserve capacity through education, intellectual activities, social engagement, and physical fitness. People with more cognitive reserve handle brain changes better. Their symptoms might be less severe. Their decline might be slower. So the things you do now, throughout your life, to keep your brain active and healthy, those are investments in your future. If you're worried about someone else, a parent, a spouse, a sibling, here's how you can help. Pay attention to changes. Notice things. Not in a paranoid way, but genuinely observe. Has their personality changed? Are they struggling with things they used to do easily? Are they getting lost in familiar places? Are they asking the same questions repeatedly? If you notice real changes, encourage them to see their doctor. Don't be accusatory. Be supportive. Frame it as, "I've noticed you seem a little forgetful lately. I'd feel better if you got checked out. Could we make an appointment?" Make it easy for them. Offer to go with them. Offer to drive. If they've been diagnosed or are in the process of getting diagnosed, be patient. This is scary for them. They're dealing with a lot of emotions: fear, denial, anger. These are all normal. Learn about the disease. Educate yourself. It will help you understand what they're going through. Take care of yourself too. Caregiver stress is real. If you're caring for someone with Alzheimer's, you need support. Join a support group. Talk to a counselor. Take breaks. You can't pour from an empty cup. Let me wrap this up by saying this. Alzheimer's disease is common. It's serious. But we're learning more about it all the time. We have new diagnostic tools. We have new treatments on the horizon. And we know that the lifestyle choices we make, the exercise, the diet, the social engagement, the cognitive stimulation, these things matter. They matter for risk reduction. They matter for cognitive reserve. They matter. If you notice signs in yourself or someone you care about, get evaluated. Bring it up with your doctor. Don't wait. Don't downplay it. Early detection changes everything. And in the meantime, live in ways that protect your brain. Move your body. Feed your brain well. Stay socially connected. Challenge yourself. Sleep well. These aren't just good for preventing Alzheimer's. They're good for living a vibrant, engaged life. That's what we're really doing here. Thanks for watching. If this video resonated with you, please consider subscribing. If you have questions or comments, drop them below. And most importantly, if you recognize any of these signs in yourself or someone you care about, reach out to a healthcare provider. Your doctor is your partner in this. Don't hesitate to have the conversation. Take care of yourself and each other.